You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Welcome to another episode of Pharmacy IT and Me. As with every episode, we start off this one stating that the intended audience for this episode are actually pharmacy technicians interested in pharmacy informatics. Alright, so we talked a lot about how pharmacists can play a role in informatics because of their expert knowledge of medications, but we sometimes overlook the importance that a pharmacy technician can play in informatics. Pharmacy technicians are often the backbone of community pharmacies and health system pharmacies, but pharmacy technicians can also play a significant role in pharmacy informatics. In fact, some of the best pharmacy informatics and EHR analysts that I know actually had a background of being a pharmacy technician. So let's talk training. As a pharmacy technician, they are well engulfed in the workflow of the pharmacy. This includes everything from buying and ordering the medication, to production of medication, to the final delivery of the medication in the inpatient setting. In the outpatient setting, they are key in retrieving the prescriptions and working on the insurance submissions, then filling it and providing it to the patient after it's been verified. Because of the amount of involvement that a pharmacy technician has in the process, they are well equipped to know what points technology will affect the workflow. So, when a new piece of technology or workflow change comes in for the process improvement, pharmacy technicians would be the best people to know how to train it, because they not only understand where it affects the workflow, but they work in that workflow day in and day out. Their experience of daily workflows can greatly assist in their ability to actually train it. What about policies and procedures? Usually, when a new piece of technology is implemented, a policy or procedure is created with it. Pharmacy technicians, again, are part of the workflow, so their input into how the policy is written is very important to ensure that the policy reflects proper practice. They are kind of like the boots on the ground and will be able to chime in on any steps of enforcement that need to be modified to be more realistic. So in terms of billing, typically from what I've seen in the hospital setting, the buyer who purchases all the medications is a pharmacy technician. The buyer would know and understand what the drug prices are and how to get the best cost. They also have a relationship with the vendors from years of working with them to acquire the medications. Because of this, the pharmacy buyer would have key knowledge and skills when there's a new piece of technology that makes the buying more efficient. So some hospitals qualify for the 340B drug pricing program, and in this program there is a strict criteria of who is qualified for what and who receives what discount. So there are optimization software out there that a pharmacy buyer would be the best person to understand and use because of their knowledge of the drug prices. In terms of project management, pharmacy technicians are so well at adapting to the work around them. Many technicians are able to think on the fly and learn skills on the job to adapt to what is needed for that environment. Because of their adaptive and quick learning behavior, pharmacy technicians would also serve as a great project manager if they have the desire to take on as a lead on certain projects. So for certain projects, a pharmacy technician as a project manager would be both more cost efficient and cost effective than having a pharmacist be one, because the pharmacy technician's natural instinct of adaptive learning and knowing what pieces are necessary for the final product. In addition, pharmacy technicians are always working with customers, whether it be outpatient patients or inpatient nursing staff and doctors. The customer service skills of a technician is typically very strong, and this is absolutely necessary when being a project manager. Being a project manager doesn't mean just managing the project, but it also means working with a team and building good relationships with the vendors and the support staff. A pharmacy technician's experience with customer service allows them to succeed in that aspect. In terms of technology coordination, whether working in an outpatient setting or an inpatient one, pharmacy technicians are very used to working with technology, whether it be robotic dispensing machines, IV compounding workflows, automated dispensing cabinets, etc. A pharmacy technician's experience alone in working and troubleshooting these machines on a daily basis puts them in a nice position to be more involved with coordinating that technology. By having exposure to it on a daily basis, not being afraid of technology, we should look to pharmacy technicians as the bringers of change and embrace how their resourcefulness will help the profession in the long run. Hopefully by now, you can understand why that even if you are a pharmacy technician, you can find a great role in pharmacy informatics and technology. Pharmacy technicians are always said to be the backbone, and in the informatics side, it's no different. So I've also placed a link in the show notes to ASHP's stance on pharmacy technicians in informatics if you'd like to learn more. Alright, if you like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme or our Instagram at PharmacyInformatics. Or you can email us at pharmacyitme@gmail.com. You can also follow me on my personal Twitter account at TonyDowPharmD. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.